For so many new moms, that postpartum journey can feel, well, pretty isolating. There are these challenges that are just incredibly common, but we almost never talk about them out loud. So today, we are shining a huge spotlight on one of the most important topics out there: how to reclaim your core strength and your confidence after having a baby.
Let's just start right here with this powerful statement. Does that sound familiar? I bet it does, and you are so not alone. But here's the most important thing I want you to hear. This is not your new normal. It's a treatable, physical issue, and today, we're going to break down the science and the exact clinical plan to get you on the road to recovery.
Okay, so before we can fix anything, we've got to understand what's actually going on, right? What is happening inside your body? It is so crucial to know that this is not in your head. It's a real physical injury, and getting a handle on the mechanics is honestly the very first step toward healing.
I want you to picture this. Your pelvic floor is like a living trampoline. It's this amazing, powerful, woven hammock of muscles that stretches all the way across the bottom of your pelvis. And its number one job? To hold up your bladder, your uterus, and your rectum against the constant pull of gravity. Pretty important?
Now, for 9 straight months during pregnancy, this muscular hammock was holding up the ever-increasing weight of your baby, the placenta, all that fluid. It was under constant, heavy strain, day in and day out.
And then came delivery. Wow. For a vaginal birth, those muscles, which were already tired, had to stretch up to 300% of their normal length to let your baby through. Think about a rubber band that's been stretched way too far for way too long. It doesn't just snap right back. It sags.
And that sagging, that's what leads directly to what's called stress urinary incontinence, or SUI. So when you cough or you laugh, the pressure inside your belly just spikes. The problem is, those weakened muscles can't clamp the urethra shut fast enough, and a little bit of urine leaks out.
Now, if that hammock stays severely weakened, something more serious can happen. Pelvic organ prolapse. And this is literally when the organs that the pelvic floor is supposed to be holding up start to sag or drop down into the vagina. This is exactly why rehab is not just nice to do, it is absolutely critical.
Okay, so we've talked about the problem. Now let's get to the solution. Just like you'd rehab a torn ligament from a sports injury, your pelvic floor needs a proactive, consistent clinical plan. So we're going to walk through a 5-step protocol designed to rebuild that core strength. So here's the matrix, the 5 rules we're going to dive into. First, we have to find the right muscle. Then, there's a specific daily Kegel prescription. After that, we'll learn a technique called the knack. Then cover the really important 6-week lifting ban. And finally, master your breathing. All right, first things first, and this is a big one. You simply can't exercise a muscle if you can't find it. And get this, research shows that over half of women are actually doing Kegels wrong. They're squeezing their butt or their thighs or their abs instead of the actual pelvic floor. So here's how you find it for sure. The next time you're on the toilet, I want you to try and completely stop your pee midstream. Feel that deep internal lift and squeeze? Those are the muscles you need to be targeting. That right there, that's your pelvic floor. Okay, and listen up, because this is an incredibly important warning. Only do this little test once or twice just to identify the muscle. Do not make this a regular exercise. If you do it all the time, you can actually confuse your bladder and end up with infections. This is a locator tool, not a workout.
Okay, what's so interesting about this is that the recovery plan trains 2 totally different types of muscle fibers. First, you've got these slow marathon Kegels. That's where you squeeze and hold for up to 10 seconds to build endurance. Then you've got the fast sprints, quick, hard squeezes to train those fast reaction muscles for a sneeze or a cough. The prescription is to do this whole set 3 times every single day.
Rule number 3 is learning what's called the knack. This is all about training your brain. You have to start consciously squeezing your pelvic floor 1 second before you do anything that spikes that internal pressure, like coughing, sneezing, or lifting your baby. It basically acts like a biological shock absorber, bracing the hammock for impact.
This next rule, I know, is a tough one, but it is absolutely crucial. For the first 6 weeks postpartum, your healing muscles just cannot handle extra weight. So you are on a clinical restriction from lifting anything heavier than your newborn. And yes, that includes a lot of daily things like groceries, laundry, and even lifting up an older toddler. Following this rule is just non-negotiable if you want to prevent prolapse.
And finally, Rule 5 is all about breathing. You must never, ever hold your breath when you lift something or strain.
Holding your breath forces all that internal pressure straight down, right onto your vulnerable pelvic floor. The rule is simple, and it's a game changer. Blow before you go. Always exhale when you exert yourself. That sends the pressure up and away, protecting all those healing tissues.
All right, now that we have the action plan, it's time to tackle some really common and honestly dangerous myths that can actually set you back and make things worse. Let's break these down with some real medical science.
So, a very, very common myth is that having a C-section gives you a free pass on all this pelvic floor stuff. A lot of women think that if they didn't deliver vaginally, they don't have to worry about leaks or prolapse. But here's the reality check. Those 9 months of carrying the baby's weight are what cause the primary weakness. That relentless downward pressure tires out the muscles no matter how the baby makes their exit. So C-section mamas absolutely 100% must do their Kegels just as rigorously.
Okay, here's another deeply ingrained cultural practice: aggressive abdominal binding. The idea is that if you tie a cloth super tight around your waist, it'll magically push all your organs back up and give you a flat stomach.
This is so dangerous. I want you to picture squeezing a tube of toothpaste right in the middle. The pressure has to go somewhere, right? It's forced straight down, directly onto your weakened pelvic floor. This dramatically increases your risk of prolapse. Gentle support can be fine, but this kind of harsh binding is a huge no-no.
Now for our last and really critical section. While some mild weakness after birth is normal, there are certain red flags that you should never, ever ignore. Knowing when to call for help is a huge part of having a safe recovery.
So if you see or feel an actual physical bulge coming from the vagina, or you get a heavy, dragging, falling out sensation, or if you have a total loss of control, I'm not talking about small leaks, or sharp pain during sex after you've been cleared for it, please call your doctor immediately. These are signs that you really need a professional evaluation. So let's end right back where we began. You do not have to accept this as some noble price of motherhood. Your pelvic floor is a muscle, and just like any other muscle, with patience, with the right exercises, and with some solid scientific guidance, it can and it will get strong again. Be patient with your incredible body, follow the plan, and please never, ever be afraid to ask for help. Recovery isn't just possible, it's what you deserve.